is to be a doctor, to be a psychiatrist. I'm supposed to be anything. So, and I've been doing it in many different settings. Right now I'm working for a community hospital, but it's an academic hospital. So I'm working in an outpatient clinic. So right now I'm working in an office. It's funny, I don't know if you asked me that for purpose, but we are in January and it's been 10 days without heat in the building for some of our offices. So right now I'm working in kind of ski clothes because we're a community hospital and have blankets. So it's very interesting to do the work in those ways. So when we have sunshine outside, I see patients outside. And actually that's bringing me, because the last 7 years I've actually been working in the field, which is really work. When we speak in the field, means visiting people in their home, in the street, in jail, in boarding care, in all kind of places, which was so important for me, who had initially in Europe a private practice, people coming in a very nice office, people coming in a hospital or in a clinic. Here I was able to see the person I was meeting where they live, in the kind of neighborhood where they live, which can be a neighborhood where myself, when I'm driving there with the social worker, we're not totally feeling safe because, you know, gangs are all around. But I can see also the condition, the noise, the fact that the bedroom is just a sheet between the kitchen and the other place. So I've been seeing so many different places where we sense patient from the hospital. And that's for the beauty of the program I work with, and the fact that I can teach and resident, the people who are trained with us can see that. I can see someone not only when they come in an emergency room or when they're on the unit or when they come and visit us, but we can visit, I would say, you, where you live, on your territory, which is a total different story, where if someone visits me where I live, I may be open in a different way. So that ability to visit people where they live, it's extraordinary. And I really speak to the fact that we can do such an amazing work sometimes because we're building that relationship among human beings, knowing where we are at. And with patients where initially thought that nothing could help them, nothing had worked. The jail, the hospital, the ER, the medication, nothing worked. Rebuilding a healthy, respectful relationship, and then from there, using medication, using some other ways, can transform a life. And so the place where I work, I'm very diverse, and I'm very thankful for that, because for a lot of doctors, the only way they're gonna work is seeing, it's like in a factory. Right, you see a new patient every 15 minutes. You're in the office behind your desk, looking at your computer, not looking at you. I'm typing my note because I have 15 minutes. I just have 15 minutes. And I need to build to make sure if something bad happened, legally I'm going to be covered, right? And still I have to know what's going on with you in 15 minutes. It's impossible. I really don't think it's impossible. This morning we had a little inside research session with psychologists, social workers, and psychiatrists, and it was about secondary trauma, how you get affected when you're working as a psychiatrist, as a social worker, as an environmentalist, as a journalist, as a lawyer, when you work with people who are in so much need, when you feel overwhelmed because it's a never-ending story, abuse and loss, and how it's important for you to get some support. And one of the things I was saying, when we look research in that field, it's very little research written by psychiatrists. And I was half jokingly saying, well, no wonder. Psychiatrists have so little time. They don't know what's happening in the liver. They don't know about the trauma of their patients. They know the vital sign and a little bit of the reaction to medication, and that's it. And we don't want that medicine. That's not good psychiatry. That's not good medicine.